Well, imagine waking up almost every day feeling stiff and sore and making it painful to move and even get on with your day. But now imagine that you're feeling that way, not when you're 70 or 80, but just 10 years old. 24,000 Canadian children live with juvenile arthritis. So for Childhood Arthritis Month, we're joined by Kayla Baines right here, her dad Dean, and Dr. Let me get it right, Marinka Twilt from the Alberta Children's Hospital. Thank you all for being here this morning.
Thank you.
Why don't we start with you, Kayla? So how did you even know you had arthritis? I heard it had something to do with your neck.
Well, my neck, when I woke up in the morning, it was like really stiff and I couldn't move it very well. It was like kind of just stuck there in a position that wasn't very comfortable.
Oh dear, yikes, that must have hurt.
Yeah.
I bet. So then that took you to the hospital, and now you've got this diagnosis of arthritis. What does it feel like in the morning when you wake up? Do you have soreness and stiffness in the morning?
Usually not, but some days it's just very like usually like my elbow or like arm is sometimes like stiff or something, but that's not usual.
But that's not usual, okay. But now that you're in care with the good doctors at the Alberta Children's Hospital and you've got some good treatment, how are you feeling these days?
It's really like, it's a lot better than before. I can like do anything else that I could do when I was like 5 or 6, which is a nice thing.
Oh, that's so nice. Let's talk to your dad for a second. Dad, Dean, what's it like for you as a parent to see your daughter living with this every day and hurting and sore?
When it first happened, it was absolutely terrifying. She had a sore neck, and then that progressed to she couldn't move her neck.
Oh, goodness.
And that eventually landed us in the Alberta Children's Hospital, and she had some problems before, but they were very subtle. She had low weight and just redness on her elbows, which we thought was eczema, and we looked at different things. It's really, really subtle how it comes about. But once she was diagnosed, things really started rolling, and she's improved like so much. It's just fantastic, and we can't thank the Alberta Children's Hospital.
They're pretty amazing there, aren't they?
Yeah, enough, and Dr. Benzler and all the people that have worked to help her get better, because it literally changed her life.
Wow.
Completely.
Isn't that wonderful?
Yeah.
Dr. Twilt, let's talk to you a little bit about that. What do you want people to know about childhood arthritis? I mean, they can go from being quite, ill and sore and stiff to doing quite well.
Yeah, they can. The problem with kids is that they adapt so well, right? So that's why it's really hard to actually notice that they have arthritis. Older people will complain much more. So the kids are so resilient that they will just use the other hand, or they'll just find another way to walk if they have troubles with their knee.
Oh, wow.
So that's why it's really hard for physicians to actually notice what is going on, and for families as well.
For sure.
And people still think arthritis is for older people.
Yes.
So if Kayla says I have arthritis, most people say you can't, you're too young, right?
Right.
And nowadays we have so much good medication now, because I started in 1995 and we didn't have anything.
Right.
And we just started to have like methotrexate, and now we actually have like great biologic treatments that change Kayla from like day to night, right?
Wow,
yeah.
Incredible.
Yeah.
Well, very quickly, I want to just get to, Kayla, you actually get to go to camp this summer, and you get to be just like a regular kid out there with some other kids, and it's medically supervised, which is probably nice for the parents, a little bit of reassurance. What do you think about going to camp?
I'm really excited to go to camp.
I bet you are. What are you going to do there at camp?
Well, I've heard there's like a hot tub, and there's like this climbing place, and like there's your own little cabins that you share with a few people. And I'm really excited about it.
That sounds so great. We'll have a wonderful time at camp this summer, and thank you all for being here this morning. Let's go back out to Winsport now, and Andy.